Thank you very much for giving me the opportunity to explain some of the virtues of the CHUI program. Ultrasound, prior to CHUI's instigation, had largely been an art that had been developed by individuals to a high level of skill, but hadn't had the scientific rigour applied to it. And when CHUI started, there were only a few privileged ultrasonographers. It wasn't widespread. The situation currently is vastly different. CHUI has spread to many countries, perhaps even as many as 50, a number of ambassadors, perhaps 150 of those, and we have seen the widespread engagement in ultrasound. In addition to spreading the word on ultrasound, there's been a number of scientific advances. 2 highly significant papers have been written about the use as a treated target and the algorithms, which are now part of the standard management of perhaps the most common treatable condition in the Western world.
Since 6 years with this program, we have permitted ultrasound really to enter in the clinical practice of rheumatologists, because at the beginning we were just teaching what ultrasound can do, but after 6 years we have really seen what ultrasound does every day for the benefit of the patient and for the clinical management and for the improvement.
I think in the future ultrasound will be such a core part of medical training, of assessment of diagnosis, of assessment of outcome, that we will look at it as an aberration when we didn't use ultrasound, given that it's so good at picking up things when they're very difficult clinically. It has been called the joint stethoscope, and I think that's very apt. We would not now examine joints which are difficult to examine without ultrasound, and CHUI has been a very important part in taking this major advance in many aspects of medicine forward.
I think that the future will be even more exciting, because we are really moving to other area of evaluation, and now that we have this very huge network, we are able really to change the patient life.
A critical aspect of CHUI, of course, has been the commitment of Abbvie. We've been fortunate enough to have a great team. And currently we have a very ambitious program going forward, which I think will yield even more results. We're working on the basis of building on the success we've had so far, and I think there will be exponential advantages in continuing the program, which we are very, very excited about.
I think that Abbvie, in supporting the use of ultrasound and the imaging techniques for improving the clinical management, has made a great effort really for permitting us to work together with the patient for treating this disease. Ultrasound is probably the best advantage that we have at the moment to evaluate objectively the inflammation at joint level. And with the improvement in the knowledge, in the standardization, and in the application of the daily practice, I think that we will change patient outcome.